Well, thank you. Well, let's get on to Nicole. Nicole, thank you so much for being here. We're really excited to learn more about NC Care 360. So we'll pass things over to you.
All right, can you hear me okay?
Yes.
All right, great. Thank you so much for having me today, and everyone else for sticking with us through some of those technical difficulties. But I am here. I am very excited to talk to you all about NC Care 360. And so I will share my screen very quickly. All right. And are you all able to see that okay? Okay, great. So before I get started, I just want to mention that NC Care 360 is a big program with a lot of moving parts. So I'm just going to give you all a very high-level introduction today to who we are and how we work. And since this is just kind of the tip of the iceberg, so to speak, I'll provide some contact information and some instructions toward the end for anyone who would like to continue this conversation, whether that's looking to get more information about how our program could work for you and your communities, or looking at next steps for possibly joining the network. So with that, let's begin. So NC Care 360 is a program that really focuses on those unmet social needs or social determinants of health in a community that really influence health outcomes. And I'm sure that you all in this space are very well aware of the impact that these social factors can have on a person's health and well-being. And while we know that access to high quality medical care is critical for good health, research shows that up to 80% of a person's health is determined by those social and environmental factors that people experience in their everyday lives, both before and after receiving medical care, and of course, the behaviors that emerge as a result to coping with those factors. So here we have the top 4 priority domains for unmet social needs in North Carolina, which are food, housing, interpersonal violence, and transportation. And these are just the needs that show up most often, but of course we know that there are many other social factors that need to be addressed for whole person health, like physical and mental health, benefits navigation, income support, education, and so on. So with that in mind, we know that there are these social needs existing in the communities, but we also know that there are many organizations out there that can help address these needs. But the biggest challenge we had seen in North Carolina when it came to actually connecting people to those community resources was that the process of making those connections was very inconsistent. It was not coordinated, it was not secure, and it was not trackable. So if someone needed help finding resources, they would get referred to other groups, or oftentimes they were bounced around from place to place with no real way of knowing if that individual actually received the help that they needed. So in order to fix that, we created a tool that would make it easier to connect people with the community resources that they need to be healthy. So that's where NC Care 360 comes in. We are the first statewide network that unites healthcare and human services organizations with a shared technology that assesses for and identifies unmet social needs and enables a coordinated, community-oriented, person-centered approach for delivering care in North Carolina. And that is a mouthful. So let's talk a little bit about what that actually means. So on the most basic level, NC Care 360 connects all types of providers together to systemically address those social determinants of health. So we're a coordinated network, meaning providers such as healthcare providers, clinics, hospitals, community-based organizations like food pantries, diaper banks, churches, et cetera, are all onboarded and connected in this shared platform where they can communicate with each other in real time, assess for and identify those unmet social needs, then make electronic referrals and securely share client information together, and then track those outcomes. So they can see if a person was connected to the resource that they were just referred to. And this really helps enable, or rather ensure that everyone's on the same page, the person is less likely to fall through the cracks, and it really helps to close that care loop. So to give you an example of what this could look like in real life, NC Care 360 serves as the infrastructure for the Community Health Worker Initiative in North Carolina. So we have hundreds of CHWs onboarded onto the network, and they're using it to make referrals for their clients. It started out for clients in their community who were quarantined during COVID-19. But let's say that a CHW, and we'll call her Jane, visits a client in her community named Tim. And so Tim has been out of work for a little bit, and he's been unable to afford food. And so Jane, when she visits Tim, can log into the NCCARE360 network, find a nearby food pantry or some other organization that can meet that food need that is also in the network. And then Jane can make a referral to that organization on behalf of Tim. So that food pantry will receive the referrals and determine that, yes, they can assist him with his food need. So then the food pantry will accept that referral and then contact Tim to work with him to get him set up to receive food, whether that's delivering the food to him or whatever the service or food or need may be. So then the next time that Jane follows up with Tim, she'll be able to see in the NCCARE360 platform that the food pantry followed up with Tim and provided the resources that he needed. So then Jane can start helping Tim focus on any other health issues that may have popped up. So the way that we do this is through a public-private partnership between NCDHHS and Foundation for Health Leadership and Innovation, where we at FHLI serve as the administrators of the program. So we hold the contracts with partners, just ensure that deliverables are being met and that everything runs smoothly. But we really make the program happen with our implementation partners, who are Unite Us, United Way of North Carolina, NC211, and Expound Decision Systems. And this public-private partnership is also really important because it's what allows those community organizations to join and use NCCARE360 for free. So there's no cost associated with joining and using the platform. And the way that our organizations work together to make these connections are that we have a robust statewide resource directory, and that is supported by the resource team at United Way and NC211. And this team regularly updates all of the resources listed in the directory, and then they work to add new programs and services and locations to ensure that they're as up to date as possible. The NC211 resources are also replicated for the NCCARE360 platform, as well as what we call out-of-network resources. And then those resources are replicated and are viewable to search both on nccare360.org as well as NC211. And we also have a team of dedicated navigators who support any complex referrals that come through, and they can also support organizations that may not be able to stay with the client throughout the referral process. And they are housed in the 211 call center, but they are assigned specifically to support those NCCARE360 cases. And they also support self-referrals that come in through the assistance request form on our website. Then we have the shared technology platform, which is the actual referral system itself. And that's where providers and organizations are sending and receiving those electronic referrals and tracking the outcomes. And that, of course, is powered by Unite Us. And because they are the partner that owns and manages the platform software, they also provide all of the onboarding, the training, the technical support, and they do that through their community engagement team, who works with users to get them onboarded, trained, configured, and then they also support them in their use of NCCARE360. We are available in all 100 counties in North Carolina, and that just really helps providers connect folks to even more community resources. It allows for feedback and follow-up and helps ensure accountability for services being delivered. And in July of 2021, we joined with NC Serves to increase the number of resources available for active duty service members, veterans, and their families. So now they have access to all of the programs and resources in NCCARE360, as well as those that are specifically designated for the military. And before this unification, NC Serves was only able to refer the veteran population to resources, but now they can actually start addressing family needs. So they can refer veterans partners, children, and other family members with those identified needs to the NCCARE360 network to get connected to resources that are available to civilians. That's a wonderful thing. Another wonderful thing that we are excited about is our NCCARE360 Health Equity Grant. So we received funding from DHHS through the CDC's COVID-19 Health Disparities Initiative Grant. And we had been hearing from many of our NCCARE360 users that one of the biggest challenges to utilizing the program was that they often ran into limited capacity of community-based organizations to be able to respond to the amount of referrals that they were receiving, especially in some of those rural areas where resources were somewhat limited to begin with. So we used this funding as an opportunity to engage in a project where we directly funded organizations to support not only their use of NCCARE360 and to grow the network as a whole, but also to increase their capacity for providing resources and services in their communities. So we had two grant opportunities. One was a community organizations health equity grant, which funded the organizations themselves and to increase their capacity to respond to those referrals. And those organizations were rewarded grants in the range of $25,000 to $100,000. And then we had a network support agency health equity grant. And this was a role that we created to fund organizations that could help support those community organizations on the network through meaningful technical assistance and guidance. Also, I kind of think of them as sort of mentor organizations because they could help those community organizations with other things such as financial planning or sustainability, things like that. And those organizations were awarded grants up to $250,000. So we launched these grants in two pilot regions, the first in the Triangle and one in the Triad, and that was in May of 2022. And the grants run until May of this year, and we're hoping that the impacts will be enough that we'll be able to show that it was really meaningful, and we'll be able to extend those opportunities to more parts of the state in the future. Just to give you an idea of how the program has been doing since we started in 2019, we have had more than 117,000 clients served, more than 229,000 referred cases, more than 3,000 network organizations actually join the NCCARE360 network, and of those organizations, more than 8,000 active programs are receiving referrals, and almost 50,000 users who are those folks in the from those network organizations who are onboarded onto the network, and they are sending and receiving those referrals directly through NCCARE360. And of course, we work every day to onboard even more organizations to increase capacity to serve more individuals and communities. So if you like what you've heard and are interested in learning more, or if you're ready to get started with joining the network, we would encourage you to visit the nccare360.org/join page on our website, where you can enter some information about your organization, and then someone from our onboarding team at Unite Us would contact you to get more information and kind of walk you through what joining would look like. So those, that's NCCARE360 in a nutshell. It was very quick, very high level, only brushes like the very top. But yeah, if you're looking for more information, feel free to visit our website at nccare360.org, and you can always send us an email at connect@nccare360.org as well.
Well, thank you, Nicole. We do have a question from one of our members, Mary Bethel. Mary?
Sure. Thank you. And thank you all for what you're doing. I had a question about updating information about agencies that are already in. Do y'all routinely update it, or do you rely on the agencies to provide you with updated information, or how is that done?
Yeah, so we do rely heavily on the organizations to let us know when there are updates that need to be made, and you can do that through working with your community engagement manager at Unite Us. With our resource team at NC211, they are working on those out-of-network resources, which are the resources that are in the resource directory that they manage. And then they sometimes will help us if they notice that sometimes there are organizations that get that go from the out-of-network to in-network. So say they've been ready to join the network and they've decided to onboard, then they can help us with that. But we do rely on the organizations actually being able to send us those updates so that we can make those. And organizations, the administrator of the organization that has NCCARE360 access is able to go in and make their own updates to their programs as well. So program descriptions, hours of operation, phone numbers, contact information, things like that.
Great, great. Any other questions from the group? And Nicole, I know you shared the contact information. We'll try to put that in the chat too. This will be, oh, Heather, you're raising your hand.
I am. Sorry. So, do you think should we go on those of us that do a lot of community referrals? Should we go on to NC360 and kind of look around? Like I have my list of places I always refer friends, clients, community members to, and see who's there. And then what if we know there's resources and they're not listed? Like my good friend runs the Meals on Wheels, and for some reason, if the Chapel Hill, Carrboro, Orange County Meals on Wheels isn't there, do I contact them? Do I contact you? How do I make sure that the resources are there?
Yeah, so if you are already onboarded onto the NCCARE360 network and you say, oh, I know this organization, we refer to them all the time, but they are not onboarded, that is something that you can work with the community engagement manager at Unite Us. That is part of their role with the program, is helping to identify and recruit and onboard those new organizations. So you could give them their information, or give the community engagement manager the information of the organization, then they could reach out. Or if you have relationships already with that organization that you think should be onboarded, then you can help make those warm introductions to kind of facilitate that process as well. But yeah, definitely, we're always looking to try to get as many of those organizations onboarded as we can. Because we know that the resources are there. And then when you have the out-of-network resources, so those are the organizations who are not, maybe they're not ready to join yet, or they just haven't, but they're still in the community providing resources. So they are a valuable resource that we can still refer to. So that's an out-of-network resource, and it would look more like your traditional referral then, where you're sending a phone call or an email or just printing out some information for the client and letting them control when they contact that organization. It's a little harder to track that way because you don't have that direct connection, but it is possible. So a lot of times, what we are doing with our Unite Us community engagement managers and our NC211 folks is looking at this list of organizations that are in out of network, and then trying to work with them to, look at their readiness and capacity to get them to join the network. So yeah, always let us know if you have ideas for organizations that should be onboarded, and we can look into them for sure.
Great. Mary, did you have another question?
Yeah, I did. So I know that a lot of local agencies are, maxed out right now because of staffing shortages or other types of things. So are you running into challenges where some agencies and organizations don't want to be listed because they're afraid they're going to get more referrals than they're going to be able to handle?
Yes, we have seen that. And the good thing about the platform is it has the ability to be able to pause your services. So if you are at a point where you just maxed out, you're not able to accept any more referrals at the moment, then you can, indicate that in the platform so that you don't receive any more of those referrals until you're ready, and then you can turn that back on. And then I had another thing and I lost my train of thought. I'm very sorry. But that is very helpful, because a lot of organizations will say, okay, well, we're just at capacity right now, but we don't want to leave the network. We just need to suspend services for a month or two until we can raise our capacity back up, and then we can start accepting referrals again. And then the other issue, or not issue, but the other thing that you can do is, we like to tell organizations it's not a bad thing to reject referrals. So if you have a referral come to you, and if the person is just not eligible, say, for example, or if you just don't have the capacity at that time, you can reject that referral, and it'll go back into the platform for the sender to find another organization to send it to. And one of the reasons that is not a bad thing is because that shows us where the gaps are in resources and needs. So if there's a particular need in a community and the one organization that serves that need is just completely overwhelmed, then we can gather that data and say, this need is here. How can we then work with this community, or decision makers, or whomever it may be, to be able to address those needs, because clearly they're there and it's, they need to be addressed. So I see a question in the chat. Does NCCARE360 have redundancy of services built in if there is a need and capacity is challenged? So I think, so what will happen, and this may be a better question for our community engagement managers at Unite Us, but we do have, you know, all of the organizations who are providing a service or resource for that service type that are onboarded, are listed in the platform. So you can, you know, find the closest organization to you. It's also possible to do what's called batch referrals. So if you know that there are several organizations who can meet the need, but you're just not sure which one, or you just, you know, it's more of an urgent need, you can send the same referral to multiple organizations, and then the first organization to accept that referral will take it, and then it'll cancel out the other referrals to the organizations that were not able to accept it. So did that answer your question, Charlotte? I just want to make sure that I'm kind of understanding what you're asking.
Yes, that's great. Thank you.
Okay.
Very helpful
Okay, good.
information. I appreciate it.
Wonderful. Yeah.